Dental anxiety or fearing the dentist is a problem that many people have and something that is somewhat difficult to overcome. This fear normally prevents rational people from visiting the dentist and maintaining the health of their teeth. The key to keeping your teeth healthy is to prevent problems before they start. And those who suffer from dental anxiety will try to avoid going to the dentist, which results in problems. When someone who suffers from dental anxiety finally goes to the dentist, they normally find that even the smallest of problems can turn serious and require a lot of work and intervention from the dentist. Even though you may not realise it, regular visits to your dentist is the best way to keep your teeth healthy and prevent problems such as decay and cavities. You can use several techniques to overcome dental anxiety. Some of the techniques require mild sedatives, also referred to as sedation. Sedation is a way to relax. It's given by breathing or IV intravenous through a vein in your arm. Sedation will help you to calm down, although you will normally be awake to answer questions or talk to your dentist. Some people who suffer from dental anxiety have had bad experiences. Any type of negative dental experience will normally result in emotional scarring and last for years. Anything that results in negative feelings for the patient will normally cause them to feel in a negative way towards the entire dental profession. Although all dentists aren't bad, a negative experience will certainly make a patient feel that way. When you look for a dentist, you should always ask your family and friends who they use and who they recommend. When you visit a dentist, you shouldn't hesitate to ask him any questions that come to mind, so you can be more relaxed. You should always keep in mind that you are the customer, and the dentist is the one who needs to make you feel relaxed. Never should you feel intimidated, as the best dentists will do everything they can to establish a sense of trust. Establishing trust is very important with the patient-dentist relationship. You'll be going to your dentist on a frequent basis, so you'll want to be sure that you can trust him. When you go to your dentist for the first time, you should let him know about your dental anxiety. If he isn't willing to talk about it with you or do things to help you relax, you should look into a new dentist. You can always tell who the better dentists are by the type of facilities they have. Dentists who have a lot of customers or nice offices have established themselves and prove that they are indeed the best. If a dentist has a lot of customers, it lets you know that he has them for a reason. People that are satisfied with a dentist normally return. If you suffer from dental anxiety, you should always let your dentist know in advance. Over time, you'll find that you can overcome your fear and establish a great relationship with your dentist. It will take you some time, although your dentist should be willing to work with you on that. But before you know it, you'll be over your fear and more than willing to go to your dentist. When it comes to toothache, there are many different things that can cause it. A toothache can come at any given time, even though you may not expect it. The pain can be so unbearable at times, and you'll do practically anything you can to make the pain stop. When a toothache first comes on, many of us start to wonder what caused it to happen. Some of the main causes of toothache include decay, a fracture in the teeth, and cavities. A crack in the tooth is also a cause, although it can be difficult to diagnose, as cracks will normally appear to be invisible to the naked eye and x-rays. Cracks can make your tooth feel as if it's exploding, as they expose the dentin and nerves to the air and anything else you put in your mouth. If you don't get them fixed, they will get worse, possibly leading to your tooth breaking off at the gums. Pulp irritation is another cause of toothache, as it occurs after dental treatment. No matter how well your filling or crown was done, the materials that we use to fix the tooth can end up causing pain later on down the road. There really is nothing you can do, as crowns can sometimes come off or the filling can sometimes come out. And if this happens, all you can really do is go back to the dentist to get the problem fixed. If you have an exposed root or nerve, it can also be the cause of your toothache. This normally happens due to rough brushing receding the gums and exposing the root. If the root is exposed, the air or liquid you drink can trigger a toothache. To prevent this from happening, use care when you brush and never try to tear your gums apart thinking it will get your teeth cleaner. If you use tobacco products, you will more than likely get toothache on a frequent basis. Chewing tobacco is a common contributor to toothaches and tooth pain, as the tobacco will eat away at your teeth until there's nothing left. It doesn't take long for it to happen either, especially if you have been chewing for a long time. Smoking can trigger toothache as well, as the smoke is bad for your teeth and eats away at them. Even though there are many causes to toothaches, there are things you can do to stop the pain and prevent toothaches. You should always brush your teeth on a daily basis and go to the dentist for your regular checkups. If you get a toothache, you should always go to the dentist and get the tooth fixed. The dentist may be able to catch it early enough to save the tooth, which will prevent you from having to get it pulled and save you a lot of money and pain in the long run. Brushing and flossing are something we all learn at an early age. The proper way to brush your teeth takes less than 2 minutes, although many people tend to spend much longer or much less. Most adults tend to spend less than a minute, which isn't enough time to clean your teeth. To get the right amount of time brushing, you should try using a stopwatch while you brush. When you brush your teeth, you should avoid using pressure, but instead use short, gentle strokes. You should focus on hard to reach places and make sure that you get the areas between your teeth as well. You should also make sure you get eating surfaces as well, along with your upper and lower gums. If you focus on all areas of your mouth, you'll get everything when you brush. Along with using the proper brushing techniques, you will also need to use the right toothpaste as well. There are a variety of toothpaste available, designed to help you with a variety of different conditions. You can get toothpaste that will prevent toothaches, stop sensitivity, and prevent things such as tartar and gingivitis. Toothpaste is the best way to protect your teeth, therefore you should always ask your dentist what type of toothpaste he recommends for you. To get the most out of brushing, you'll need to have a good toothbrush. There are many different models to choose from, which can make it extremely difficult to choose one. When you make your choice, you should look for brushes that have soft bristles. Soft bristles are easy on your gums, and they will remove plaque and other debris from your teeth. A small head is also preferred, as it can easily reach hard to get places, such as your back teeth. You should also remember to replace your brush every couple of months, or when it starts to show signs of wear. If you've had a cold, you should replace your toothbrush simply because the bristles contain the germs that could get you sick all over again. Toothbrushes that show wear should always be replaced, as they can have an impact on your gums. If the bristles start to get worn down, they can tear away your gums, leading to sensitivity. To get the most from your brushing, you should always use a bit of common sense and ask your dentist for his recommendations. Brushing your teeth will help keep them healthy and prevent the build-up of plaque and tartar. Keep in mind that brushing does help your teeth, although you still need to go to your dentist for regular checkups. If you take care of your teeth and brush them on a regular basis, you will keep them free of infections and cavities. Along with brushing your teeth, you should also be flossing on a daily basis. Flossing will remove plaque and debris in areas that your toothbrush isn't able to reach. A build-up of plaque can lead to gum disease or tooth decay, which is why flossing is very important. If you floss immediately after brushing, you'll notice that your gums and teeth will be much healthier. When you look at dental floss, you'll notice there are two types, nylon and single filament. You can get nylon either waxed or unwaxed in several different flavours. Nylon floss is made up of several strands of nylon material, meaning that it can shred, tear or snag between the teeth if it gets caught up on sharp teeth. Even though the single filament floss is more expensive than nylon, it will slide easily between the teeth, even tight areas and spaces. Unlike nylon, single filament is impossible to shred or tear. No matter which type of floss you choose, as long as you floss regularly, it will move debris from your teeth and gums. If you've never tried flossing before, you will probably be amazed just how much debris and food particles it can remove. Flossing is recommended by dentists everywhere, as it can reach places that even the smallest of toothbrushes can't. Food and debris will build up between your teeth, which makes dental flossing very important. The main problem many people have against flossing is the fact that it can result in bleeding of the gums. Anytime you floss and get between your teeth and around your gums, the floss will rub against your gums, resulting in bleeding. Many people take this the wrong way and immediately stop flossing, usually for good. Bleeding is very common and should be expected with flossing. When you brush your teeth, you miss a lot of food particles and debris that continues to build up in your mouth. No toothbrush is designed to get every area of your mouth, as all of them miss hard to reach places. With the areas missed by the toothbrush, the debris and plaque will continue to build up until they eventually result in a cavity or decay. To get this debris and plaque before it builds up into something more serious, you'll need to floss. If you've been afraid to try flossing due to the bleeding, you should really get over that fear and floss after you brush. To keep your teeth and gums healthy, you ought to brush and floss your teeth. Regular checkups with your dentist will help as well, although it is up to you to continue your regular maintenance at home with flossing and brushing. If you floss on a daily basis, you'll quickly realise just how clean your teeth and gums will be. Fillings are very common with dental work as they present a way to repair a tooth that has suffered from decay or a cavity back to its original shape. When performing a filling, the dentist will remove the decayed area of the tooth, clean around it, then fill in the area that he has removed with a special material that will cater to the shape and form of the tooth. Fillings work by closing out the area where the bacteria enters into teeth, helping to prevent any type of decay in the future. The materials used for fillings include porcelain, gold, composite resin and amalgam. There is really no best type of filling as several factors come into play. Your reaction to different material, the shape of the tooth, extent of repair and where the filling is needed will be determining factors as to what material is used with your filling. The gold fillings that are used are made in a laboratory, then cemented into place by the dentist. Gold material fits well with the gums and can last you for many years. Gold is considered by many to be the best, although it is also the most expensive and will require you to visit the dentist several times before the filling will be complete. Silver fillings, on the other hand, are less expensive than gold materials and they can be quite resistant to wear. With their colour being dark, they are easier to notice than composite or porcelain fillings and aren't recommended for visible areas of the mouth, especially the front teeth. Composite fillings are a common type of material as they match the colour of your teeth. The material that makes up the composite filling is mixed, then placed directly in the cavity where it hardens. They last several years, although composite isn't recommended for large cavities or areas where they may chip. The final type of filling is porcelain. The porcelain is very common and produced in a lab where it will be matched to your teeth, then bonded to the affected tooth. Porcelain fillings match the colour of your teeth and are resistant to any type of staining. The costs for porcelain fillings can be very expensive, some costing as much as gold fillings. If a cavity, decay or even a crack has managed to damage a large area of the tooth, you may need a crown or a cap. If the decay has managed to get to the nerve, you may end up needing a root canal to get rid of the dead pulp. When a dentist decides he can fill your tooth, he will remove the cavity, then fill the hole with one of the materials we've previously mentioned. Depending on your insurance and what you can afford, you can choose which one you want or take his recommendation. In most cases, porcelain or composite fillings will be recommended. Gold fillings are popular, although most people want a filling that will match the natural colour of their teeth. Keep in mind that only a dentist can make the decision regarding fillings. When you visit for your routine checkup, the dentist will look in your mouth and use instruments that will let him examine the surfaces of your teeth. If he finds any cavities, he will usually recommend a filling. You won't feel anything as he will numb the area. It normally takes less than an hour and you'll be up and at him before you know it. A filling is great for cavities as most look natural and they won't result in the loss of your tooth. Dental extractions are among the easiest and best ways to get relief from a toothache. As the name implies, an extraction involves removing the tooth. If your pulp has died or the tooth has become severely infected, extraction may be your only route. Depending on the tooth, the dentist can do either a simple extraction or a more complicated extraction. Simple extractions. These types of extractions, the simple extractions, are the most common in the world of dentistry. During a simple extraction, the dentist will remove the tooth by loosening the gums around the socket. He will grasp the tooth with forceps and move it from side to side until he can get it to break free from the socket and remove it. The teeth are held to the bone by a thin piece of soft tissue. This soft tissue is known as the periodontal ligament. The dentist uses this tissue to remove the tooth. As you may know, the key to removing a tooth by pulling is to rock the tooth from side to side, which enlarges the socket in the bone and breaks the ligament that helps to hold the tooth in place. Simple extractions, also known as pulling, don't take long to complete. The dentist will numb you before he starts, so you won't feel anything. Depending on the tooth, pulling it will normally take just a few minutes after you have been numbed with local anaesthesia. Once completed, the dentist will place gauze in your mouth to bite on and you will be free to go. Complex extractions. As we all know, not all teeth can be pulled. Sometimes the tooth will be so decayed or broken off that the dentist will have nothing to grasp above the gum line. In cases such as this, the dentist will need to perform a more complicated extraction, which involves getting the tooth out below the gum line, as he won't be able to use the standard method of pulling and rocking. These types of extractions involve the dentist making an incision in the gums around the tooth and raising the flap he cut to expose the bone. Once he has exposed the bone, there may be enough of the tooth exposed for the dentist to grab and remove it using the pulling method. In most cases, however, the tooth will be embedded in the bone, meaning that the dentist will be unable to pull the tooth out. With teeth that are embedded in the bone, the dentist will need to use a drill and chip away at the bone to get to the tooth. This is known as cutting the tooth out, and happens to be very common with impacted teeth or teeth that are severely decayed. Once the dentist has cut his way to the tooth and removed it, he will sew back the flap of skin that he cut to get to the tooth. The flap of skin and the socket will heal over time, providing you take care of it. Dental extractions are very common and happen on a daily basis for dentists. Oral surgeons are the best for extractions, as extractions are all they do. All types of extractions, even the most complex, will take time to heal. As long as you take care of your extraction site, you'll avoid common pitfalls such as dry sockets and other mishaps. Although they can be painful once the procedure is over, you'll eventually start to feel a lot better once you've had the tooth or teeth removed. A root canal is a dental procedure that all of us are familiar with. Root canals are something we all dread, although when someone else is getting the procedure, most of us find it to be somewhat amusing. When someone asks for a root canal, on the other hand, most of us, including dentists, find it to be very absurd to say the least. Although many aren't aware of this, root canals have been around for many generations. Many years ago, ancient civilizations used this method to save teeth that would have been lost otherwise. These civilizations offered root canals to those such as queens, kings, pharaohs and the rich. The teeth from peasants were normally extracted, then sold to aristocrats. Many years ago, doctors believed that worms were the reason for tooth decay. They also believed that there were many ways to kill the worms, including rinsing the mouth in one's own urine both day and night. Although this is sick to say the least, this remedy was discarded in 1728, proving to be non-effective and replaced by other more suitable treatment. As time passed, doctors proved that the best way to stop the pain was to clean and remove the nerve and pulp of the tooth. Root canals are a very common procedure these days, as they help to save the tooth by removing the dead or dying pulp. The pulp exists inside of the tooth and can spread to abscess if it isn't taken care of. The tissue in the pulp is kept alive by the blood vessels that come from the tip of the root and travel along the root canal into the tooth. Decay is the main reason for pulp in the tooth dying. Once the decay has reached the pulp, it will keep eating away until the pulp has died. And once it dies, the toxins from the decay will be released into the root tip and make its way into the jawbone. If it's not taken care of properly, the jawbone can become infected, which can lead to death in rare cases. To fix this problem, the dentist will need to perform a root canal. During the procedure, he will numb the area, then drill a hole into the tooth. Using various tools and equipment, he will go down inside of the tooth and scrape away the nerves and dead pulp. This is a very effective procedure, although very time-consuming as well. In most cases, a root canal can take several hours, although it is the only way to stop the dying pulp and save the tooth. Even though it may take a long time, it is more than worth it when it saves your tooth from being extracted. An abscess in the tooth refers to an infection that was caused by a pocket of pus residing in the tissue around the tooth. Abscesses are very serious conditions and can lead to serious matters if they aren't treated immediately. When the pulp of a tooth dies due to damage or decay, bacteria will begin to grow from the dead tissue that is left. This bacteria will eventually spread from the root of the dead tooth into the tissue that is below and create a pocket of pus. Gum disease is also a cause for a tooth becoming abscessed. Gum disease causes the gums to pull back and away from the teeth, leaving pockets behind. When one of the pockets becomes blocked, the bacteria can grow and spread or get backed up. When this happens, an abscess will start to form under the surface of the gums and become apparent with swelling as it gets bigger and spreads. Once infection has started to spread, your jawbone may start to dissolve as it makes room for the swelling in the area that has been infected. Once the bone starts to dissolve, the pressure will be greatly reduced, but the infection will still be there. Once more of the bone has been dissolved, there will be nothing left to support the tooth, and it will become loose and end up needing to be extracted. The symptoms of an abscessed tooth are easy to see, as they include severe pain in the infected area, red or swollen gums, a bad taste in your mouth, swelling around the area or the jaw, and possibly a high fever. Pain is excruciating with an abscess, normally affecting the area in a bad way. No matter what you do, the pain seems to intensify. Abscesses mostly occur with the back teeth, although they can happen in the front as well. If a tooth that has abscessed is extracted once the infection is still present, it can quickly spread. Your dentist will instead prescribe you some antibiotics that can help to destroy the bacteria. The dentist can also perform a root canal in an attempt to remove dead or decayed tissue. Last but not least, he can also drill a hole in the tooth to give the infection a chance to drain and try to remove any dead pulp. The most common treatment with an abscess is to use antibiotics to kill the infection and then get the tooth removed. You should never let it get that bad though, as an abscess is something that can destroy your jawbone. As millions of people all around the world know, sensitive teeth can make life in general a nightmare. Sensitive teeth comes with pain and discomfort that can make eating or drinking your favourite foods a painful experience. Although you may suffer from sensitive teeth, you can rest assured that they can be treated. Normally this condition presents tooth pain after drinking cold liquid, eating hot or cold foods, or breathing cold air. If the pain becomes too much to bear, you should immediately see your dentist, as the nerve of your tooth could be exposed. Normally, sensitive teeth starts when the gums begin to pull away from the teeth. With the gums being a protective blanket, they cover and protect the teeth's roots. And when the gums recede and pull away, the roots have no protection and therefore they will be exposed. The exposed root tips contain small tubules that lead directly to the nerves of the teeth. Whenever pressure, hot or cold elements travel down the tubules, it will trigger the nerves and result in pain. Those who don't have sensitive teeth will have their gums covering the tubules, which prevents these types of things from happening. The idea here is to stop tooth sensitivity and keep the gums healthy. If you reduce the pressure you use when brushing your teeth, you'll find that your gums will remain healthy. When taught to brush their teeth, most people are instructed to use a lot of force. And while this can get the teeth clean, it will also tear at the gums, which can lead to sensitive teeth. If you have sensitive teeth now, you should try using an electric toothbrush such as the Sonicare Advanced. Although you may have sensitive teeth now, there are ways you can help to improve your gums and your teeth. There are several toothpastes out there on the market that contain potassium nitrate, which helps to reduce pain and discomfort associated with sensitivity. Although there are several toothpastes to choose from, Sensodyne is the preferred. It's recommended by dentists as being the best simply because it affects the nerve of the tooth and stops the pain where it starts. Mouthwash can also help tooth sensitivity, providing it contains fluoride. You can also ask your dentist which mouthwash he recommends, as there are several to choose from. Scope is a great brand to use, as it offers you plenty of fluoride without any alcohol. Unlike Listerine, Scope won't burn your mouth when you use it. It will leave you with a clean feeling and get your mouth and teeth completely clean, killing millions of bacteria. If you start using fluoride toothpaste such as Sensodyne and mouthwash, you'll notice a big improvement in your teeth and gums. The sensitivity will begin going away, giving you almost immediate relief. When you brush, make sure you brush gently and avoid using any type of force, as it will always cause your gums to recede again. In the event that using Sensodyne and fluoride mouthwash doesn't help, you should ask your dentist about other options available to you. Your dentist will know what will help you, so you shouldn't hesitate to ask. He will also know how to eliminate your sensitivity once and for all, and how to prevent it from coming back. Tooth sensitivity is something that many of us have to deal with, although there are ways that you can fight back and prevent the pain and discomfort associated with sensitivity from making your life harder than it has to be. Not many people are aware of the fact that several herbs can be used in the relief of toothache pain. Natural herbs such as cloves, calendula, tarragon and yarrow can be used to help relieve the pain until you can get to the dentist. For many years, different cultures have counted on herbs to help get the pain of toothache under control and get temporary relief. Native Americans, for example, use the inner bark found in the butternut tree to their gums to get relief from toothaches. The butternut tree is found in North America and is also the cousin of the black walnut tree. Butternut trees are found along rivers in well-drained soil-rich woods and even in backyards. Once the tree matures, it can reach heights of up to 60 feet, with the bark being light grey in colour and the leaves and the fruit resembling the black walnut tree. The bark of the tree can be applied to the gums, helping to alleviate toothache pain. Yarrow, on the other hand, can be found in Asia, Europe and North America. It normally grows wild in meadows, fields and in open woodlands. The root of yarrow is what contains the anaesthetic effect. If you apply the fresh root of yarrow to your tooth or gums, it will help stop the pain, until you can get to an appointment with a dentist and get it taken care of. The herb known as clove is an evergreen tree native to tropical areas. These days, however, it can be found throughout the world. As many already know, the dried flower bud of clove is what contains the medicine. The oil from clove, when used on a toothache, will help to stop the pain almost immediately. If you compare cloves to other natural toothache remedies, you'll find clove to be the best. For many years, natural herbs have been used to stop toothache pain. Hundreds of years ago, herbs were the only way to stop the pain. Dentists were just starting to come around, although they didn't have near the equipment and sophistication that they have these days. Even though teeth were pulled during these times, it normally happened with alcohol to numb the pain, then pliers to remove the tooth. Throughout the course of time, herbs have proven to be very effective with stopping toothache pain. If you're interested in herbs or have any questions about them, you shouldn't hesitate to ask your dentist his opinion. Dentists know herbs and should be able to recommend natural remedies to you if you request them. So the next time you experience the pain of a toothache, you should always remember that herbs are a great way to relieve the pain.